we will go through all of the benefits. So I'll highlight them. Either we can chat afterwards if they're personal, or a team member of mine can definitely help you. Because I'll go through a lot today. You might go, I don't even know what you're saying, or forget what I say. So we have resources to help, but we'll go through everything. One of the big things I'll touch on is actually short-term disability. So you have actually had that as a voluntary benefit, but we're switching it to an employer-paid benefit. So I'll go into a little detail of what that means, but that's a great enhancement that you have this year. And then just next steps. So Employee Navigator, the portal, is something that we provide, and that's actually where you'll go to elect your benefits. So a little bit about us. Really, my main job is to work on the benefits all year long. So giving you guys, cutting edge benefits, the best possible plan designs at the lowest rates. That is really my big role in negotiating with the carriers. But we also provide, other resources. So we do provide you that Employee Navigator website, as well as we're your reference. So we're your resource for anything benefit related. Of course, you go to Meg, and then she can pass you along to us. If it's a personal question, maybe you're recently diagnosed with something, or you want to know how medication's covered, maybe even finding a dental provider, it's anything related, you can reach out to Tracy. So she is our dedicated employee advocate. What I'll say about Tracy's role is, she's in the office, Monday through Friday. So it's not a call center, perhaps, where you can call at night or on the weekends. We wouldn't want you to do that. If it's an emergency, go and take care of that, or contact the insurance carrier, Blue Cross. However, she's there to be your resource. So maybe it's a matter of you get a claim in the mail and you don't know, do I actually owe this amount of money? Was that my deductible? Because our plans have a deductible on there if you're enrolled in the PPOs. What do I do? So she's your resource to help with that. If you authorize her, she can speak to the insurance carriers on your behalf as well. Additionally, I want you to feel comfortable. Anything and everything you do share with anyone in our office. So if Tracy's ever out, she has a backup, or if you were speaking to me, one of my assistants, you feel confident that we're not sharing that information. So none of that comes back to Guerrero. We're not discussing it. We would actually be out of business as a consulting firm on benefits if we shared in your personal information. So I just want you to feel confident that it is protected by privacy laws. Open enrollment, so it actually begins today, and it will go through midnight next Monday. So this is where you're learning about all of the benefits offered. Maybe you didn't elect something. This would be the time that you could come on to any of the plans. So maybe you're covered elsewhere on a parent's plan, on a spouse's plan. Maybe you have an individual plan. If that's all ending, you can come on starting September 1st. It additionally is where you would consider, do I need to cover my dependents? Do I have a spouse or children? Is my spouse's plan better for us, or our plan here? This is that kind of one and only time that you make those elections. They are in place for 12 months until next year, where you could make a change again. So we kind of do this yearly, giving you the option to maybe switch your plan, unless you have a life event. So they're not events that Guerrero sets, they're actually IRS qualified events. So most common is birth, adoption, marriage, divorce, and then loss of coverage. So that's where you're covered somewhere else, you lose that coverage. All of those allow you to make a change to your benefits on the date of that event. So you have 31 days to make those changes. So, birth, most of the time people remember, oh, I gotta get my child on the plan. Sometimes marriage, we forget. You go on the honeymoon and then you forget, oh, I forgot to add my spouse on. If it's after that 31 days, the IRS doesn't allow you to put them on your plan. So it's kind of, if there's a life change, think about your benefits and you need to make a change there. Okay, moving on. So Blue Cross is still our insurance carrier. There's no change there. We'll talk about the HMO plan first. So this plan is a little unique if you're on it currently or maybe considering this plan. It doesn't have a deductible of any kind. Really how an HMO works is it's managed care by your primary care physician. So you pick a primary care doctor. Everyone on the plan can have a different physician if they need. So a pediatrician, your spouse can have a different primary care physician, but they're in Blue Cross's Blue Advantage HMO network. So you see them for everything you do. You don't have flexibility to kind of go and pick and choose your doctors. You see your primary doctor, and they refer you to other physicians as you need them. So if you need a specialist, perhaps they're going to refer you to the person that they pick. You don't get to just choose. So most of the time that HMO doctor is affiliated with a group. So it could be like Northwestern Medicine. They're all going to be in that same group. So that's kind of where you would be seeking services. You can change your HMO doctor once a month as well. So sometimes people pick the HMO plan. You randomly maybe pick a physician. You go in, you have your annual physical, and you're like, yeah, not the doctor for me. You can change. So even though you're in that plan for a year, you're actually not tied to the doctor for a year. And then everything you do is a copay, and then 100% covered. So Blue Cross covers everything else after that applicable copay, depending on the plan or the benefit that you're utilizing. Additionally, you might think, okay, it's network only coverage because I pick my provider, everything's at Northwestern. What if I'm traveling? Do I not have any coverage? The answer is you have coverage, but only in an emergency situation. So, if you're, let's say, in Colorado skiing and you're kind of feeling under the weather, you want to go see somebody. If you go in, you actually don't have coverage for that because it's not an emergency. But if you're skiing, you break something, you go to the hospital, you absolutely have coverage. So that emergency room only is what you have on that HMO plan. I see heads shaking, so that's good. You're actually, hearing what I'm saying. I know it's early still. Well, it's 11, whatever. Okay, so Blue Cross. There's 2 PPOs to pick from. One is a traditional PPO plan. The other one is more of a high deductible consumer type of product. So we'll talk about each of them, but they are both national networks. So it's Blue Cross's national network. In that same scenario, if I was traveling in Colorado, I'd absolutely have coverage out there. Not only emergency room, I have in-network coverage as well. No referrals are required on these PPO plans, so I get to pick and choose who I want to see. So I may still see my primary doctor, but then, I'm recently diagnosed with something. I can actually pick the specialist that I want to go see wherever I would want to see them. As long as you're in the network, you're never going to get that balance billed. You're always going to just get that level of benefits, but you do have out-of-network. The likelihood you go out of Blue Cross's network is very slim. It would be maybe if you went to like Mayo Clinic. They're not in the network, but you're going to find good coverage. Most of our clients are insured with Blue Cross, and we really have some people out of network on the plan. There is an annual deductible. So that means you have to pay a certain amount before Blue Cross pays on the plan. It is annual, even though we're talking about what goes into place September 1st. It goes through the end of December. So anything that you've met thus far towards your deductible actually is still in place until December, and then January it actually resets. So it would start over. You might wonder, where do I pay deductible? When does that come in? Why do I have to pay that? Think of it as anything outside the doctor's office.
Sorry, which of the two?
Both of them.
Oh,
Yep.
okay.
Both have deductibles. Yeah.
But I mean, for everything up now also?
Yeah. So, you have deductibles currently on the PPO, my understanding?
Yeah, you just said more than, you talked about more than the deductible. So.
For the traditional plan, there's co-pays on that, so I'm going to show you what the plans look like. But on both plans, they have deductible if you're outside the doctor's office. One plan, everything goes towards your deductible. So that consumer-driven plan, so I'll show it to you in a second. If you're not answering your question.
Yeah, you've talked about more than just deductibles with the so far. You also talked about like traveling and going to the emergency room. That all that information also go towards both PPOs?
Yes.
Okay, that's what I was
Yes. Sorry, I missed your question there. I need more coffee. I've been up since 5. Little child at home. So yes, emergency room coverage on both plans. You have coverage out of state on both PPO plans. What else did I mention? Co-pays only
There's been
apply
a lot
to
of information already.
Okay. I'll just keep going. Maybe it'll all sink in, or you can ask another question. Maybe I'll answer your question there. But your traditional PPO, if you're on that plan, and I'm going to show you what they look like. That deductible, again, everything's calendar year on both of them. They go through December, runs over January 1st, they begin again, so they start over if you've met anything. The traditional plan does have co-pays if I'm getting prescriptions or if I'm in the office. The consumer-driven plan, everything actually goes towards meeting your deductible. So there's no co-pays on that plan at all, but there's an HSA account that you can set up, so I'll talk about that as well. So let's look at the plans. Maybe this will help a little bit here. I know it's probably hard to see, but they're also on our Employee Navigator website. So the full list of what these look like. Even when you're electing your benefits, you can compare two plans side by side. So you can actually see the differences by each line item. So our traditional PPO is that $1,000 deductible. And I was saying that only comes in when you're outside the doctor's office on that plan. Because if you're in the doctor's office, you're just going to pay the copay of $20 or $40 for a specialist. So if I'm having, let's say, an MRI, scheduled surgery, maybe it's an inpatient stay at the hospital, maybe it's my lab work that I have done, all of that is outside of the doctor's office, so my deductible would apply in that scenario. My worst case scenario, I like to call it that because it's your maximum out of pocket in a calendar year on that plan, on that PPO plan, is $2,000. Because Blue Cross pays 90% if I'm outside my doctor's office. So let's say I have a hospital stay and my bill is $10,000. Well, we don't pay $10,000. We're going to pay the first $1,000, so we haven't met our deductible yet. Blue Cross pays 90% of the remaining balance, and I have a 10% up to an additional $1,000. So the most I'd spend on that bill would be $2,000 for the rest of the calendar year. And then actually everything's 100% after that, you would pay more. So that's kind of your worst case scenario. Our HMO, you'll notice there's not a deductible on there. Like I said, it's just a copay for everything that you have. So $20 or $40. If I'm inpatient for emergency, you can see it's $150 copay. I will tell you, if you go to an urgent care, you're always going to save money. So if you have like a retail clinic you can go to, again, making sure it's in the network. On our PPO plans, HMO is always required to see a primary doctor. So you can't take advantage of those urgent cares. Sometimes you might say, you know what, I just need to go. And most of the time they're like $90, but you would have to pay that. It would go under the HMO plan. And then our last plan is that PPO consumer plan that I was talking about. So the IRS actually mandates this plan. And they require that we bump the deductible up $100. So if you're currently on it, it's a $2,600 deductible. It will be a $2,700 deductible, and then 100%. So kind of that same thought process. If I have a $10,000 hospital bill, on this plan I actually have to pay the first $2,700, and then the plan covers 100% for the rest of the year. But this plan, you won't see copays for office visits. You will not see copays for any prescription drugs, which we'll talk about in a second. Because everything you do goes towards meeting that deductible. The IRS will allow us to open a health savings account that's tied to this plan. So it's called an HSA. A little bit about an HSA. For 2018, a single individual can actually decide to put aside $3,450 into a savings account. It's all pre-tax, so it comes out of your paycheck, goes into that account, and you can utilize it for your medical expenses. So most of the time, people kind of do save for that deductible because it is $2,700, but you actually can use that money for dental and vision. So it's IRS regulated, just like our flexible spending. If you've ever heard of that, it's exactly kind of the same thing. You're saving pre-tax. So the good news is you're saving an estimate of about 30% on that because it comes out before the IRS is taking any taxes on that payroll. Money goes in tax-free, money goes out tax-free. You never lose the money, which is very nice. So it truly is a savings account that just stays there as long as you need it open. It doesn't go away if you don't use it in a year. So it truly is that savings account. So maybe this year you take the high deductible plan, you open the HSA, but then next year at open enrollment, you're like, Kelly, that wasn't the right plan for me. I want to switch back to the other PPO. You can do that. You just can't put more money into that HSA, but it's still there. It's still there, so you never lose it. You can change your election too. So that's kind of nice. So maybe you start out small. You want to build up your account, and then something happens, you're diagnosed, or maybe you want to get dental work done. You want to put a little bit more money in. You can change your election. So you're not locked into that payroll election. You can even stop it completely. So it's not locked in all year long. It has flexibility should you need it. I heard, yes.
IRS annual, that's how much?
Yes, per year. If you're employee plus one or more, so if you cover yourself and a child, even a spouse or the full family, you can put in $6,900. And actually, these might really increase come January 2019. There was a new law, so the Senate needs to approve it, and then the president would have to sign it. But it actually is going to double them. So you could put in a whole lot of money if you wanted to. Yep. Okay, prescription drugs. So this is hard to see, but iMed has this presentation so you guys can see it as well. And then everything again is on our Employee Navigator website. But our traditional plans, so our traditional PPO and our traditional HMO have copays on our medication. Our high deductible plan with the HSA, that's where medication costs all goes towards your deductible until you need it, so 100% after your deductible. But they tier medications differently. So they look at them quarterly, and they may say, oh, that brand name is now a generic, so it goes to the cheaper copayment. Or maybe it stays at a brand name. They bring new brand names on, perhaps. Blue Cross does look at the listing of medications quarterly. So you could notice a change. They are fairly good about notifying you if something were to change. So if you've taken a medication in the last 6 months and they make a change on it, traditionally they do let you know about it. But they also have preferred pharmacies. So if you get your medication at Walgreens, Walmart, Jewel Osco, you're always going to pay the lowest cost for that medication because they're preferred. Blue Cross partnered with Walgreens. I don't know if you saw any news on that, but that was a huge partnership. So if you go to Walgreens, you're always going to pay the least amount because they're kind of like this. And then the performance formulary is just the name of the formulary that you guys are on, that our plans are on. So again, that's where they kind of look at the medications. That's a list of medications they cover. Also, too, if you do mail order, I don't have it up here, but it's definitely on our online. If you do mail order, you can save in copays, as well as if you go to one of those preferred pharmacies, you can actually get a 90-day supply of a maintenance medication right there at the pharmacy. So I'm with Blue Cross. I go and I get a medication, and I actually get 90 days right there at Walgreens. I don't have to mail anything in. So additionally, they have a lot of medications that are free too. So you might go, I didn't pay anything for that. Why was it zero? We don't question, we just get our med and we keep going. So yeah. Some value-added features I wanted to remind you guys that you have access to. So this is PPO only. So our PPO and our high deductible plan, this applies. You actually have telemedicine on your plan currently. So this means you can virtually connect with the doctor for non-emergent things. So this is not, uh-oh, I was out back, I cut my finger off or whatever, I was cooking dinner. That's emergency room. This is more those kind of pesky things, like your cold and flu symptoms. Maybe the kids have an ear infection. You're outside, you get, you're weeding or something, you got poison ivy, it's a rash, whatever. Also, behavioral health or depression issues is also something that's wonderful. You know, you're not having a good day, you're feeling down, you just like to talk to somebody. You can actually reach out to MD Live, so it's in partnership with Blue Cross, you know, and they may refer you on. They can also prescribe medications for you. So if it is, let's say, that ear infection, you know, you probably just need an antibiotic, and you can get that through the plan. On average, it's a $40 cost. It could be a little bit less, you know, for that virtual visit. Questions we always get: who am I calling? Am I calling in the country? What doctor am I talking to? They are all licensed in the state in which you're calling, because you can use this when you travel. So if you're in Colorado again, you're going to get a local Colorado doctor. And this is all that they do. So they have been in practice for 15 plus years, but they're only a virtual medicine doctor now. And they're, of course, pediatricians, internists, family medicine, or any of those behavioral health specialists that you might need. So you have this on PPO only, again, because HMO has to go to their primary doctor for everything. Additionally, this is hard to see, but this has been in place actually for 4 years now. So preventative care on all of our plans, even including our high deductible plan, is covered 100%, no cost share. So that means I can go and have an annual physical, women we can have our mammograms, pap smears, men can have a well man care visit, children immunizations, their well visits, all covered 100%. You wouldn't actually pay a copay or any deductible for those visits. What I will say is a lot of times we might go in because we're managing something. So maybe we're taking a medication, an allergy med, and that's why we have to go to the doctor. We kind of think of that as our annual exam. They're going to do blood work, whatever it may be, make sure our medication's correct. That I'm already diagnosed and I'm already managing something. So really this law doesn't consider that preventative. Preventative is really truly, I'm undiagnosed, I'm really just going in for whatever that service is. So they kind of look at it a little different. Cost estimation, I'll go through this a little quick as well. This is PPO as well. Yeah. Yes.
So if we're calling for preventive, does that count as like an annual checkup?
Yes.
Okay.
So like your well woman checkup. Yep.
Okay, so if I go in for an annual checkup with my GP, but I already have pre-existing conditions like that, and they're still doing checkups to see how that's doing, that preventive falling through that category?
Yes. Yes.
It does prevent it. So my annual wouldn't count then.
If you went for 2 separate visits, it would. It's all how the doctor codes that claim. So if you're going in because you're managing something and that's why you need to see the physician, they're going to code that claim with that diagnosis on it versus just a well visit. So
I just need to ask my doctor to code it as a well visit when I go for my annual, even though they're still checking on pre-existing conditions, because they always check on pre-existing conditions every time I see them, whether I'm going for an ear infection or an annual, or actually because there's a flare up.
okay, you could
Because
definitely
that's
ask them.
what any good doctor does when you have a pre-existing condition.
So for this, I just want to say it's only 100% preventative coverage if your doctor codes it that way. So if you have that conversation and they're willing to change how they write that diagnosis on there, or they send in 2 separate claims, you go on 2 different days. If you don't get the 100% covered, it's because of how they coded the claim.
Okay.
Yeah,
So
so
have that conversation.
you can absolutely have the conversation. Yeah, ask them.
Great. That's very good for everyone to know then.
Cost estimation is something you actually have on the Blue Cross plans, now on the PPO plans. HMO, again, remember, you always have to see that primary doctor, so they're kind of in control. But on the PPO, let's say you were gonna go in and have knee surgery, and the doctor says, okay, set it up with the nurse. I go to the surgery center as well as the hospital. You kind of pick, set the date that works for you. You can actually log on to Blue Cross's member website and click on this. It looks exactly like that, the little lady, and do cost estimation. So it'll give you a whole bunch of options, imaging, perhaps maybe an MRI or CT scan you can cost estimate. But this comes into play because you have a deductible that you would meet for all of these. So even if you're on the high deductible plan, you have to pay $2,700 before Blue Cross pays 100% for you. So here you can, try to make your money go as far as possible. So the example, like I said, wrong way, knee replacement, set it up. You're still going to the same doctor, the same surgeon. You're still staying in the network. This isn't like you're going somewhere else. But here you could actually see difference in cost. So I know you can't see it up here, but it's $18,000 to $56,000. So it's a huge difference depending on where you might have that done. So, well, my maximum out of pocket would be maybe $2,000 or $2,700, depending on which plan I'm on. I'm not going to really pay all of that. I don't really care. However, how we use the plan directly impacts the rates that you guys pay. So even if you were willing to, take a second look out here and say, hey, it's still my doctor. It's still within Blue Cross's network. Maybe I'll go to the surgery center and not the hospital. Because overall it saves the plan, money. It's lower cost. So you have that available to you now as well. Again, PPO only. Principal is still remaining as well. So they're kind of our ancillary carrier for dental, vision, life, disability. So we'll walk through those. The dental plan is a PPO. Similar to a medical PPO, you get flexibility. So you can see any dentist you want. You have in-network or out-of-network coverage. But what's different is on dental, if you go out of the network, you will be balance billed. So a lot of times it's kind of what they call usual and customary, or the average cost for something. You're going to be billed above that, and you would be liable or responsible for paying it. But dental is kind of unique because it caps you at $1,000. Dental plans don't cover you like medical, which are unlimited. They're going to just keep covering all the care that you need. Dental caps you $1,000 annually. So if you have, needs that go above and beyond that, you're having some major work done, you get covered up to $1,000, and then everything after that you would be paying for. But you get an annual deductible of $50 per person on the plan, up to 3 people. And then depending on what you have done, preventative care is 100%. So you don't pay your deductible. You're actually getting, those teeth cleanings covered 100%. But let's say we go into a filling or something more, it's covered at 80%. And then all this fun stuff that we really want to have done is covered at 50%. So, if you're having a root canal or a crown or, any of that kind of stuff, it's going to be at that highest level or lowest level, 50% coverage. Yes.
How would we find out what these average costs are that we're measuring against when we're looking at these?
So you can't get the average cost. So the dentist isn't going to tell you. You could ask them. Most dentists are not going to kind of publish what their rates are for certain things. So it's always best to stay in the network if you can. But there isn't anything that you could do. Principal actually does have something online for the providers, but I don't know how detailed it's going to be. If you put your zip code in, it may give you kind of, a filling is on average $200, and your doctor could charge way above that. You'd have to ask them their cost.
So as long as we stay in network,
you're not balance billed.
Then we're not balance billed.
Right, great. Yep. Vision is with Principal as well. It actually is the VSP Choice Network, so that's the network of providers that you can use. So Vision's great. I'll tell you, I wear contacts, glasses. If you're participating in this, you're absolutely going to see a value in it. You do get that visit annually, every 12 months. An eye exam, it would be $10, but if, like me, I wear contacts, they charge me that additional contact fee. So that could be up to $60 depending on the provider that you go to. And then you get an allowance every year towards contacts, which is $150, and then you could pay over that, as well as that same $150 towards frames every 2 years. So you could get a new frame every 2 years. You can update your lenses every single year. That's $25. So kind of. It's interesting, vision providers, they know how it works, the insurance works. They always tend to give you the best of both worlds. VSP also does give you additional discounts. If you get an additional pair of glasses, you order additional contacts, you will always get an additional discount if you're in the network with them. Okay. Basic life and voluntary life. So every employee gets a basic life benefit of $15,000. So it's not anything that you pay for. It's provided by Guerrero, but you can purchase additional life insurance if you wanted to. What I'll say is, I'm not going to kind of go through everything here, is if you're an existing employee, already missed the window to get this guarantee issue without medical questions. So if anybody's interested in voluntary life and you're a new hire, there are some rate limits. You can get up to a certain amount without filling out any medical history, which is great. But if you're a current employee and you want to take additional life, you can. When you go onto Employee Navigator, it's actually going to say that you need to fill out a medical form and it needs to be approved. So it's kind of, and sometimes life changes. We get married, we have a baby, or whatever it may be. Maybe we get a home. We buy our first home and we're like, no, I could do some life insurance if something happens to me. Maybe it pays off the home. So sometimes, you answer no to all those medical questions and you get approved. But it's not really open enrollment for voluntary life unless you're new. Disability, so I kind of mentioned in the beginning, so new as of September 1st, you have short-term disability. So some of you may already have short-term disability, but you were actually paying for it on a voluntary basis. This actually now all employees will have access to this. What short-term disability is if we need to go out for a scheduled surgery or maybe an injury, an accident that we've had, and we're not going to be able to be at work, short-term disability replaces some of our income. So it's not going to give you 100% of your income for all injuries. It really is 60% of your income up to a weekly maximum based on your pre-disability wages. So the most short-term disability we'll go for is 11 weeks. And I will tell you, there's some paperwork to be filled out. So, you just don't automatically get it. If it's a scheduled surgery, let's say you're having that knee surgery I talked about, that's scheduled. You would have a portion of the form you fill out, the doctor fills it out, and then I would have to fill out some of it. It gets submitted into principal, and they approve that disability and would let you know how long that you would be receiving those checks. This does work with maternity coverage. So if anybody is going to go out and potentially have a baby, you actually get this policy to replace some of your income, as well as Guerrero is going to work with you with your PTO as well to kind of cover the gap, because it doesn't begin until the 15th day that you're out. So it doesn't start right away, but you can use your PTO to kind of fill that, as well as that 60% sort of help you with the 40% on the maternity policy. So that's a nice enhancement that everybody, I know gentlemen can't participate in the maternity portion of it. However, it's a great benefit to have. Long-term disability is actually, let's say we're out for that. Yes?
Sorry, I had a question on this. A lot of us work here and we make some base salary and then some commission. I was wondering what wages means for those of us where a lot of what we make as take home is commission.
So this is based on whatever's put into Employee Navigator, whatever wage that may be. Base.
Okay, so that's a big difference for those of us where a huge portion of our take home is commission.
Related to this, I have filled out the disability form, and it does ask for commission on base plus commission, or whether you're that way. So I don't know if that factors in.
I believe the plan is based on base, but I'll definitely confirm and get back to Meg. That's what principal looked at, was whatever wage is put into the Employee Navigator website is what they looked at to kind of do that policy. Voluntary long-term disability kind of is if you were to extend those 11 weeks on the short term, and then it would go into long term. So if you're just not able to come back, something's still going on, you still have complications, or let's hope it never happens, but something that's going to take you away from work for the rest of your life. long-term disability actually covers you until Social Security normal retirement age. That could be different based on, you know, the year of our birth, because it's not always 65. Most of us, it'll be like 75, who knows, but hopefully that's not the case. But this also gives you, you know, that monthly income for the rest of your life shall you need it. So this is voluntary though, so you would need to elect this coverage if you feel it's something you want to purchase. So the website, Employee Navigator, is going to walk you all through that, you know, what your cost would be, because it's based on your income as well, base income, and then your age is how it's covered. So Employee Navigator, I've talked about it a lot, but that is our website. If you have been around at all here last year, that's the website that you utilized. So you would log into there, and that's where you're going to elect everything. What I'll say is we're doing a passive enrollment. So if you do not log into the site itself, you're going to roll over on the benefits you currently have. You'll roll over, everyone will roll over and get that short-term disability policy, so you don't need to elect that. You'll automatically get it. But if you do not log in, what you have today is what you will have going September 1st. If you want to make a change, you can log in there. What I will tell you is if you want to change one thing, so let's maybe say you didn't take dental and you want dental coverage now. Actually have to walk through all of the steps. So when you get in there, you can easily click on dental and say, okay, I want to elect it, hit save. However, it's not really going to complete your election. So actually, if you want to make one change or many changes, you actually have to walk through everything. Very user friendly. You'll notice, you know, check marks on the left-hand side makes it really easy to determine what you've done or haven't done. And then at the very end, you're going to get an enrollment where you actually submit that enrollment in. So if you don't do that, whatever that election is, may not trigger, because the system wants you to look at everything if you're going to make a change. Lastly, I mean, I think I've said this kind of, you know, a little bit over and over, but really think about, you know, what medical plan's good for you. You know, are you in the dental, the vision? You know, do you want to consider voluntary life, voluntary, you know, long-term disability? Again, you know, if you log into the system, you know, make whatever that election is, hit save and complete. If you do not log in, again, we'll just roll over as you are today. And then please remember Tracy. So she's there for you. Her email address, talpup@affiliatedbenefit.com. Make it difficult. Lots of I's, L's, F's in that email and B's, but she can help you. So even lots of questions that come up today, if you have more questions, she can help you look up providers, talk about the HSA plan, perhaps. Anything that we've discussed today or haven't discussed, she's there to help. Yeah.
I have Tracy's contact. I'll send the PowerPoint out to everybody, and then I'll include her one pager with her phone number, her email, all the things she can help you with, so that if at any time ask for anything reference that email.
We've had some questions, but anybody else? Oh, yes.
So the HSA account, where if you a $50 contribution, is that something we're doing?
I want to make sure.
There's no question. Sorry.
The HSA contribution, was that something that's going to continue? I believe it was $50.
Yes, everything's staying the same. The only change is here so that we're offering short-term discount.
So is that $50 when you open it, or is that when you?
I have to confirm that, because I don't get that plan, but I'll check with Mark and Dave, make sure that that's.
Yes, I'm pretty sure, don't quote me either, we'll make sure with Mark, Dave, but it was kind of prorated, so it wasn't, you know, every paycheck, like you can do deductions, it was over the course of time.
Yeah, and how historically it's been is every your second paycheck of the month, that end of the month paycheck, it comes on that. And it's $50 per person, so
Thanks for helping us.
but yeah, you can put in twice as much, you can put it on. Okay. That's fine, but the consumer PPO is just the HA. That we talked about last year. Okay. Right.
HSA plan.
Yeah, that's what the consumer
Yep.
PPO is, it's actually the
Yep.
HSA plan.
Honestly, they really are, so the HSA stands alone, with the bank. And Blue Cross just really manages your consumer-driven medical plan. But the IRS says you have to have that consumer-driven medical plan to open up this bank account. That's kind of why,
So,
we call it the HSA. However, the HSA is really the account.
so if I have a PPO and I'm rolling over into the regular PPO.
Yes,
That's
yes.
great to know.
Yep.
Thank you.
Yep. So you'll see that online. I mean, if you log in, you're clearly gonna see that you're in the PPO or the HSA, the high deductible.
So you can't open an HSA if you haven't used it.
No. Yep. HSA is only tied to that $2,700 plan. Yeah, good question. Yes.
Some of the new hires, that would be. Yeah, like 2 months.
Okay.
So will we be able to get?
No, so you would actually, you're still gonna use that Employee Navigator website, and you would go out there and elect your benefits. You should be actually able to do it now. So if you're out there, if that has in there, you'd be able to elect your benefits. They're just not gonna be effective 9/1, they'd be effective, whatever date. Yeah. November, yeah. Yes.
Yeah, I was just gonna double check with that, so I was gonna feedback on that, that's the question. Elect to date, and for our November start, will that automatically roll over to the year, or do we have to do it again?
It would roll over, yep. So just like everyone now who's electing for September 1st, it's locked in for that 12 months in the system. So
Okay.
we would be the same,
So for the
November.
new hires, we just do it that one time, it takes
Yeah.
effect for November, we'll roll over to January.
Got it.
Good.
Yep.
Awesome.
Yes.
The other thing we've talked about is just the cost per month for each of these plans. How is it changing from last year? Is it changing from last
It
year?
is changing,
That's good to
so
know.
you would see that when you actually log into the system. So when you go into Employee Navigator, you're actually gonna see what you're currently enrolled in, and then it will tell you your new election, should you wanna change it, or your, new amount, for the plan that you're in. They were different per plan.
Yeah,
Yeah.
it's only a couple. But depending on which one.
So I can-
And it's different, so when you log into your portal, it's based off of your salary and your deductions. Somebody else's, so if you have questions once you log in, it's a couple of dollars a month.
Oh, wait, so how much you pay per month will depend on our salary?
Like how much, it would be personally, for your page.
Only for the short term, remember, and then the long term is only based on your salary. But the medical plan,
I guess it's the same, but your total deductions are. Right?
yeah.
Oh, medical, life insurance is based off salary? Okay, sorry, yeah, well, if
Not
I'm
the
not
life
getting life
insurance.
insurance, then I'm not.
Not the life insurance. Your life insurance is 15,000, or voluntary is
So I'm
actually
asking about how much I'd be paying per month for my medical insurance, that's all I'm asking about. Premiums.
So this is right here. I just logged in for you.
Okay.
And you can see over here is going to show, this is a sample employee, it's not any real employee. You can see what your per pay was. So again, I don't know how you're enrolled and what plan you have,
I'm in the regular PPO, I'm happy to say that.
or is it just
I'm proud of
yourself?
my plan. Yeah, it's
Just
just
you,
me.
okay. You're gonna see down here, the regular PPO will be 109.47, and it was 104.50.
And that's broken out 50% at the 2-week mark, 50% at the end.
This is per pay,
Oh,
so
per
per
paycheck.
pay.
Oh, so it's more than
$200 a month for each of those. And the HMO is still like $160,
Yeah.
$190.
That's a question. Are you able to find the in-network provider through VSP on that website, or does it navigate us to the
Sure.
VSP site?
Well, and even though it's VSP, it really is through Principal, so
Okay.
everything you're gonna do is through Principal. So actually, the best way to do it is to register, just like it is for Blue Cross. If you register on their and if you register on Blue Cross or on Principal, you're really in your own benefits at that point, and it's gonna help you find providers so that you're not just kind of randomly, or Tracy can help you. So, if you just kind of say, hey, here's my zip code, can you help me find some local providers? She can do that too. Perfect. That's a lot of questions. Who's next? Yeah.
Is the life insurance, is that tied to your employment?
It is,
So-
so
If I'm 60, I know.
the basic life insurance, is tied to being employed here as well as the voluntary. However, they are both portable, so you can take them with you if you employment, and you would just pay the cost. So Principal kind of transitions it to an individual plan.
Oh, okay.
Yep.
That's what I was asking.
Yeah,
Good question. So for any of there's a couple of things where if you're currently extra steps, I fill out a medical form, if you're adding, additional insurance, like life insurance.
yes,
And I feel like there's another one. Is that tied to this week open enrollment only if we wanted to add, or is that like anytime during the year we can add?
that's a very good question. So since the voluntary life would require you to fill out a medical form, and there's no real open enrollment for it, you can do that anytime. So, maybe you don't do that now. 6 months from now, you say, you know what, I'd actually like to get some life insurance, you would just complete the form. And then what Principal would do is either approve or decline it on a future basis. So it's not like you go back in time and have to pay anything. It would be as of, let's say, April 1st or January 1st, depending on when you would get.
So for those benefits, the open enrollment is really for people electing for the first time.
Yes, you got it. And then that voluntary long-term disability is the same thing.
Yeah.
So you could do that at any time. You just fill out that medical form, and they can approve it. Most of the time, you would do that because you're like, I've diagnosed with something, so they may decline that unless you do it when you're, healthy, fairly healthy. Yeah. But yes.
Okay, I just have two quick questions. So if nothing starts till November 1st, how far back will you all cover it? Looking travel.
Won't. So Blue Cross, yep, your plans begin November 1st, and anything after that date would fall under whichever benefit you elected. But prior to that, I don't know if you had a prior, job and they offered you COBRA perhaps, or you have an individual plan. That plan, it all goes by date of service. So anything prior to 11/1 would be whatever you have now.
And the last question is, if I decided I didn't want to do housing, I stuck in it for a year.
Yes. So, yep. Unless you have a life event. So, again, something happens. If, let's say, you get married, perhaps, and your spouse's insurance is actually better for you guys, you can come off because that's that life event. And the reason for that is nothing that Guerrero, determines. It truly is because your deductions come out pre-tax. So the IRS is actually saying, you've been getting a deduction, saving 30%, on taxes in your payroll because that's coming out pre-tax. So you have to stay in for the whole year. But you could come off next, August for September 1st.
Just adding on that, what if you're not? So does that still say, what if I feel tired?
So let's hope that doesn't happen. So by law, you have to be offered what's called COBRA. So basically the plans here, you can take them with you and you can have them for up to 18 months, but you would actually pay the full cost. So here, Guerrero is helping you quite a bit because, even let's say you're paying $200 of that cost, that's not the true cost of the plan at all. It's much higher than that. You would pay that cost to keep it. If you couldn't afford it, you'd have to, find something on your own. But that the Guerrero contribution goes away.
Just at that moment, just cancel all your plans.
If you were, let's say, if you left employment, they would end the date that you left. Yeah, so you don't have to keep paying for them. You have to kind of say you want them to keep paying for them.
So if a life event happens and you need to call insurance, you just go on the website or
you can call Tracy in our office. However, right on your home screen in Employee Navigator, it allows you to do, sorry, I'm going to go to actually what you guys see. Under benefits, you can view it and change them. So add or adjust coverage, and that's where it would say, did you have a life event? What was it? Marriage, loss of coverage, and then you would actually go through electing your benefits. Okay. Yeah. Any other questions? Yeah.
Can you or maybe Meg clarify the maternity leave and Meg used the word maternity leave last week and how that is maybe different from maternity leave and then like what Guerrero is contributing or how that's sort of working?
That's going to be part of the handbook, right?
So, we're finally, the handbook is like done, it's more or less, that we're working with a team that's helping us on formatting. So that'll be rolled out, everybody has to sign a copy, so that'll be in there. At that point, like, I would definitely talk to everyone separate, or not separately, but I'll announce what the maternity policy is. But Kelly's right, it does involve the short-term disability, and then everybody, like a parental policy will receive 2 weeks of additional leaves, on top of the short-term disability. So again, I'll get into that a little more when we launch the handbook, but it should be done in the next couple of days.
What is the practicality if you have a specialist to see maybe once a year in the HMO plan? How would you go about finding a doctor that works with you?
This comes up a lot actually. So, sometimes we don't have a primary, but we have that specialist. So you actually sort of have to work backwards. So if that specialist is in the network of Blue Cross, let's say under Northwestern Medicine, then we have to go, okay, what primary doctors are associated? So actually Tracy in my office can help with that. Even if you email her and say, I'm interested in the HMO, here's my specialist, can you help me kind of pick a primary doctor so that you'd be able to see that specialist. But what I'll tell you is if you do that, you can't just go with your specialist. Right. You gotta go to the primary first and kind of say, hey, I've had this relationship. They'll refer you over as long as you're all in that same medical group. Sometimes people too will take HMO just because it is lower cost, does cover 100% after a copay, and sort of pay to see that specialist outside of the plan once a year. Some people do that too. You kind of weigh out your costs. Yeah. Anything else? If anybody needs to chat with me, I'll be here for a little bit. Again, Tracy, I know Meg's going to send out the presentation, and Tracy, I'll pop in my office for information. Again, you have until next Monday, at midnight, to kind of go out there, take a look if you want to make any changes. If you just want to stay the same, it will roll over as is. You don't need to do anything. Okay, thank you.
Good question. If you want to find out.